Hello, everyone, and welcome to the podcast. Thank you so much for tuning in today. I really appreciate you being here. You know, the last couple of weeks, I've been spending time going through emails from listeners, from those on our email list, asking for us to discuss specific topics. And in addition to anxiety, depression, and self-concept issues, some parents report that their children and teens are struggling with emotional regulation, issues with anger, defiance, and communication problems. So I wanted to spend a few episodes this year discussing different treatment options in the hopes of providing information to families. And today we are talking about dialectic behavior therapy, or DBT. It's an approach that was researched and developed by Marsha Linehan at the University of Washington and has been adapted for children and adolescents. And my guest today is Patricia Gieselman, a DBT Linehan Board of Certification certified clinician. She's the founder and executive director of Choices Counseling and Skill Center, which specializes in comprehensive DBT for adolescents, adults, children, and their families. She's also a licensed marriage and family therapist with tons of experience working with adults, adolescents, and families. Patty is here to talk to us about why it is important to provide youth with skills and strategies that improve their ability to manage their emotions and give them the tools needed to accept those parts of their life that cannot be changed.
Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Hi, Patty. It is so nice to officially meet you.
Hi, Karen. Likewise.
Thank you so much for being here. It seems like it's taken over a month for us to get this conversation going, but I'm so glad we are doing it at the top of the year. So thank you again.
Yeah. Oh, I appreciate the opportunity.
You know, when I was thinking about having you on the podcast, I was thinking about all the children, the adolescents, young adults who are struggling not only with depression and anxiety, which we've talked a lot about on this podcast, but also managing big emotions, controlling impulses, displaying defiant behaviors as reported by their parents. And parents are often at a loss when it comes to determining appropriate treatment options. And I wanted to have you on to talk about a particular treatment approach that might be helpful to some parents who are looking into treatment options for their kids, because we know that many children struggle with the ability to understand, to manage their emotions, and it can create a lot of distress, not only for the child or the adolescent, but also for the entire family. And
absolutely.
And you specialize in a specific approach, dialectic behavior therapy. And because this is an area of expertise for you, I wanted to have you on the podcast to talk about that particular modality of treatment. And
happy to.
Maybe we can even start by just explaining what is dialectic behavior therapy for people who don't know, or DBT.
Dialectical behavior therapy is a treatment that was developed by Marsha Linehan at the University of Washington way back when. She professionally was a suicidologist and dealt with a lot of very high risk behaviors. And what she kept finding, and she's a behaviorist. So what she kept finding that many people with big emotion dysregulations didn't do well with standard therapy or even strictly CBT, cognitive behavior therapy, because it didn't give them enough connection on the relationship side. So it's like she said, okay, I'm going to try this new thing. And basically, dialectical behavior therapy, or DBT, is a combination of both cognitive behavior therapy, change strategies, and the Zen model of mindfulness. Not a religious mindfulness, but just mindfulness and that Zen practice. And so the primary dialectic, if you will, in DBT is acceptance and change. So what she found was that a lot of the therapies, people would come in with big problems, with destructive problems, with problems that hurt other people, that got in the way of their life. And it was very change oriented. A parent would come in and say, I want my kid to stop doing X, Y, and Z, or something like that. And so it became very change oriented, and they got pushback from folks who are very emotionally sensitive. On the other hand, you've got strategies, dear Carl Rogers, where there was a lot of acceptance, and that needed to be balanced with change. And I think that's what Marshall Linehan accomplished, was coming up with this dialectical process. And it's basically Kantian philosophy, if you want to think about it. We've got a thesis and we've got an antithesis. So we've got acceptance, which is way over here, and we've got change, which is way over here, and finding a way to synthesize that so that the client can then both feel validated and heard with their own struggle, and also make changes to make more effective decision making. Does that make sense?
It absolutely makes sense. Again, bringing those two things together. And when you do that, you're also teaching skills and giving people tools that they can use to manage these emotions that can often seem out of control and significantly impact so many aspects of their lives.
Yeah, DBT was kind of cut its teeth. Most of the research is done with borderline personality disorder, and a lot of people think it only treats borderline personality disorder. It's not true, because it does treat borderline personality. It treats suicidality. It treats self-harm. It treats addiction. It treats school refusal. Any problem behavior that shoots out of the hose based on the fact that I can't regulate my emotions, and therefore I'm looking for ways behaviorally to manage the situation. And it's about learning different ways. The treatment for adolescents involves the family. So the model of DBT, Alec Miller and Jill Rathis did the adaptation for DBT skills and treatment, along with Marshall Linehan, who is the author of DBT. And so their model is a multifamily treatment model. So all of DBT, whether it's adult, adolescent, or child at this point, you have a couple of components. You've got the individual therapy, which is a little different than regular talk therapy. And you've got skills groups or skills classes. So the reason Dr. Linehan broke that up is because I don't know you or the kind of clients you've worked with, but sometimes each week they come in with crisis du jour. And so there isn't time often to get those skills in there. So Marcia decided, okay, let's do the skills here. We'll teach the skills in a class, and then we'll apply it to the problem behaviors that they're working on in individual.
Right. And I love that you mentioned that this research in DBT started with borderline personality disorder, because I think a lot of people, when they think of DBT, they think of borderline personality disorder. And I would love to hear more about the DBT for Children program. And then we can talk about the program for adolescents, because, we see a lot of kids who have impulse control issues, a lot of kids with defiant behaviors. On this podcast, we talk a lot about children who have learning difficulties, and that there's a lot of school avoidance. There's a lot of difficulty kind of coping with the stressors of going to school and struggling day in and day out. And then we've also see a lot of kids with comorbid issues. We've got learning difficulties with anxiety and poor coping strategies, poor emotional regulation because of executive functioning difficulties. How does DBT help those kids, particularly those with that dysregulation of emotions?
Well, I think the more complex the kid gets, the more things you need around it. But if I just take a child, now you're talking about DBT for children now, right?
Yes, let's start there.
Okay, that's an adaptation that was developed by Francesca Perepetulakova. And our staff went through her intensive training. And the whole concept there is you have a very sensitive child who is easily reactive to the world. So these are the little darlings that, get asked to leave 3 preschools because they have trouble getting along. They have trouble not melting down. They have trouble. So rather than calling it a super sensitive child, Francesca refers to these kids as super sensors. And in regular raising children, I raised 4 and, had my struggles just like every other mother did. But it's like when you have one of these super sensors who are so in tune to the slightest, interpretation, sensation, or even physical sensation, trouble with collars in their shirts and shoes on their feet and those kind of things. So it's that what we need for the parents is to be firefighters rather than good enough parents. So for the parents to learn skills to help validate this child's experience at the same time as teaching them more adaptive ways to deal with life. Because these kids, unless they just get pulled out of life because it becomes too stressful and too anxious, which sometimes happens, and that's a shame because the bottom line is they're going to have to figure out how to live in the world, with adaptation. So it's like a lot of that work on the DBT for Children program is around teaching the parents how to create a validating environment for their child. They may have 3 kids and they have one that is a super sensor and the others are fine, but this needs special skills. So Francesca's stuff is also adapted from the original Linehan model, and it's got a parent component and it's got a child component and it's got a parent and child component. So it works with the parents initially to help them figure out, what do I need to put into my home? What reinforcers, what behavioral management systems? Get rid of the concept of punishment over reinforcement. What are the things you want to see more of? We want to reinforce that. We know punishment as a behavioral tool can be effective to block or suppress a behavior. But unfortunately, that particular thing doesn't teach new behaviors. It suppresses the behavior, and a lot of times it damages the relationship. So one of the things that I've learned from Francesca that I thought was lovely was the difference between punishment as a behavioral technique to remove something to get a behavior to stop versus retaliation. You made me mad. You ticked me off. You're ruining my evening. And now give me your phone. I think that was such an important distinction she made between punishment as a behavioral tool and retaliation. And punishment has nothing to do with anger. It has nothing to do with emotional regulation. It's like X follows Y. So anyway, so the DBTC children is heavy on parent involvement. And the research is quite phenomenal. I can send you some stuff to look at, but it's quite phenomenal in that, little kids who are in residential care by 8 or 9, or 10, they're having success with these kids and getting them home. Kids in the outpatient program or with their parents, they're having success in helping them really deal with these difficult behaviors that are keeping them out of the social and educational world.
Right. And, I'm looking at the fact that you're looking at acceptance. You're really helping parents to develop skills and giving them these validation techniques, which are so important for them to incorporate. And the other thing that's so important, I think, for so many parents to hear is that they are involved in this treatment. It's not about dropping your child off at the therapist and then getting updates on how your child is doing. They are part of the treatment approach.
They're critical. They have, in DBT for Children, these are kids up to about 11, and the research is, I think, 5 to 11, but she's done it with younger. It's like, we've got to get the parents to be able to manage their own dysregulation. As we say often, a dysregulated parent or teacher cannot regulate a dysregulated child. So it's teaching me to manage my own, dysregulation with what I'm seeing and hearing. So much of it comes from fear. I worked in residential care for about 15 years with aggressive adolescent boys, and we implemented DBT there, and we had phenomenal results.
Right. And then I think that when parents are better regulated, then you don't get that retaliation response, which is because they're at their wits' end and they just want it to stop, right? They want the behavior to stop. They want the interference to stop. They want their home environment to settle down, and they're not thinking through the strategy.
They're scared for their kids.
Yes.
It's like, what will happen if I can't help this kid get this stuff under control? And it's really a tough spot.
It really is. It really is. And you talked about these super sensitive kids. What are some common behaviors that are treated with DBT in children? Then we'll move on to adolescents.
Temper tantrums, refusals. The I just want to say first that the goals of DBT for children is different than the goals for adolescent and adult DBT. And I just want to take a minute on that because there's like a triage in adult DBT. It's life-threatening behaviors, then therapy interfering behaviors, then quality of life. It's like that's the triage. If you're at risk or putting someone else at risk, we're going to deal with that first. In the DBT for C children, the number one goal is relationship between the parent and the child. Because sometimes I don't know how to raise the child I was gifted with. And it doesn't mean there's anything wrong with me or wrong with them. So the number one goal, and the other goal of DBT for C is prevention of mental illness in adolescence. So if we can create that validating home where there's a match between the parent and the child, where they get each other and they can work with it without tolerating really awful adaptive stuff, or maladaptive things, or the controlling piece. It's like finding that little spot. I think we're going to reduce mental health issues in adolescents. That's one of their goals.
And that's so important, especially now when, we've seen this peak. We saw it peak. I think it peaked during the pandemic, although it persists long after, the peak of the pandemic. And we're still seeing a lot of anxiety and depression and mental health challenges in kids. And what I like about the DBT approach is that it's not about having a specific diagnosis that is identified and then treated with this approach. You're really looking at what are the behaviors that are causing distress for this child, causing distress for this family, and interfering with the relationships, like you mentioned.
It's very system oriented because we know that we are transactional human beings, not interactional. DBT suggests that we're transactional, and my behavior as a parent influences your behavior as a child, and my behavior as a child influences yours as a parent. And so you have a very, very colicky, fussy baby. It's going to transact and change mom or caregiver or dad. We influence each other. We cannot not. So, I tell people I'll apologize in advance that our lives will never be the same now that we've met because we have now influenced each other.
Right.
And, for bad, but the bottom line is we now have transacted. So in the children's programs, a lot of work with the parents, a lot of behavioral stuff, charts, their behaviors are being shaped, their behaviors that are being tracked for reward. There's a lot of different, a lot of behavioral stuff in that. And and Francesca herself has said, I was in a training of hers that I appreciated. She says, we can't do anything about your child's big, difficult behaviors until we have a validating environment that's available in that child's home. So again, we're back to systems theory in a lot of ways. So really bringing the parents in as the soon-to-be therapists. We want you to know what to do with your child that you're struggling with.
And it seems that with that approach, you really have to work with the parents first and create that environment before you even bring in the child into therapy.
Well, it's kind of a parallel process in DBT. It's a little bit different in DBT children as it did in adolescent, as an adult. But normally there's kind of an assessment period where the parents are finding out stuff from the parents. We're finding what the big problems are. We're trying to help the parents triage. It's like, obviously dangerous stuff first. But in the little ones, even though there is dangerous stuff, but in the little ones, it'll be triage. What is impairing the relationship the most on in the child's behavior and the parent's behavior. So we're looking at doing a triage. So I may be doing a lot of active ignoring of throwing toys if they're not throwing them at somebody, because there's a higher level. DBT at all three programs is triage based. So we're going to look at, what's the highest piece that we want to work with. We get that out of the way. Now we move down to the next and the next.
And how does the adolescent DBT program different than that of children? Because it seems like with adolescents, you also bring in high risk behaviors at that level. Can you talk a little bit about what that program looks like? I imagine the parents are still involved.
Yeah, absolutely. So the adolescent program is structured, like I said, there's Alec Miller's model, there's Linehan's model, but they're very, very similar. They're all built off the same thing. You talk to one DBT person, if they're doing DBT, you're gonna feel a flavor. And so there's a 4-week period of assessment for the child, working with the adolescent, working with the assigned therapist. And in that period of time, the parents are also getting introduction to DBT, introduction to DBT skills. And then at the end of that assessment, when we know what the kid's life worth living goals are, when we know what the target behaviors that the child is willing to work on, when we've got some understanding of what the parents are willing to do in terms of contingency management, what are they willing to give? What are they willing to hold back? And in order to reinforce the stuff, now the adolescent and their parents move into a multifamily skills group. So the parents learn the same skills as the child. They have the same workbook. They have the same homework lessons. The kids love the fact that mom and dad have, or whoever the parent caregivers are, that they have the same assignments the kid does. So it's like mom or caregiver is learning the same set of skills, the same lessons as the child, and they're both doing their homework and bringing it to the next skills group. So sometimes we do it in single families. My preference is in multifamily group because then the parents have support from other parents. The kids, other kids that are struggling, there's some reinforcement for everybody doing their homework. And so the families learn the skills. So the child then, once they get past assessment and we know what they're willing to work on, there's a thing called a diary card, which we use in both the adult and the adolescent program. The diary card is, let's say my highest target behaviors that we've triaged are I bite people when I get upset. I don't worry, but you know, I bite people when I'm upset. And I've agreed that that's getting my way. Nobody wants to go to dinner with me. You know, it's just not any, people like hanging out with me because I like getting bit. So I agreed I want to work on that. It's a problem for my family, and so on my diary card will be biting. And then each day of the week, I'll mark what were my urges to bite and did I actually bite anybody? Other things on that diary card are the highest emotions of the day. 0 to 5, anger, 0 to 5, fear, 0 to 5, sadness, 0 to 5, joy. And so what we're doing is we're tracking and noting that sometimes the behaviors are related to emotional dysregulation throughout the day. The client, whoever it is, the adolescent adult, is asked to fill this out every day and then bring it to treatment. So so the skills just keeps going. It takes about 24 sessions to get through all the skills modules for the parents and the adolescent. Same thing for adults. So the skills modules are, there are 2 on the acceptance side and 2 on the change side. There's that dialectic again. So there's on the acceptance side, there's mindfulness. We hear a lot about mindfulness. This is mindfulness that's been behavioralized. So we've got skills, observe, describe, participate. And then how we go about it is non-judgmentally, one thing at a time and effectively. So it's not just meditation. It's applying mindfulness. You and I probably both understand that we often get more in a mess as human beings by the interpretation we place on an action rather than the actual action. This form of mindfulness says, what do you see? Now let's describe it without putting an interpretation or a judgment or a intention or anything. It's like, what did they do? Well, they came in and they picked up my coffee cup. Now the thought would be, they know that's my coffee cup. They know that's the coffee cup I like to drink. Now my anger's going up because I've interpreted. All I know is they came in and picked up my coffee cup. So teaching folks the difference, we teach the parents that, we teach the adolescents that, we teach the adults that. So that's mindfulness and learning about 3 states of mind. We talk about right brain and left brain. A lot of it's just different language, but it's like we've got an emotion mind, we've got a reasonable mind, and then again, that synthesis of the dialectic into wise mind. And parents, teachers, children need to use their wise mind to make good decisions. If you're doing it all in emotion mind, it's going to be impulsive and may not be effective. There's the other, DBT thing. So that's mindfulness module. And the next module is distress tolerance in the acceptance side. And that's categories. The first category is crisis survival skills. It's like, what do I do when I feel my emotions going up and I'm likely to use my problem behavior, whatever I'm working on. So very short, very quick crisis survival skills. One of the ones for when you're at the top is go fill a bowl with ice water and put your face in it. Hold your breath. The ice dive is a very effective mechanism for bringing your emotions down because physiologically it works. Paced breathing is another one. Muscle relaxation is another one. So crisis survival skills. If your brain is ruminating, you know how we can get stuck on something? I don't know. Maybe it's just me, but we get stuck on
yes, absolutely.
Oh my goodness, what he did and what he did yesterday. And that's the 3rd time he's done it this week. my mind's going crazy. So techniques for crisis survival, like say the alphabet backwards in your head. Fill up your brain with something besides that. Because if you keep dwelling on that, you're going to wind up probably acting on it. So there's cognitive things, there's self-soothe, there's distract skills, there's go listen to music, there's go jump in the pool, there's 27 different categories of just don't make it worse. That's the only goal. And then the second half of distress tolerance is about radical acceptance. And that is learning the difference between what I have to accept and what I can actually change. And that means in this moment. I may be able to change it a year from now, but you know what? Right now I can't. So that deep understanding of knowing the difference. There's a poem called the Serenity Prayer. Grant serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. That's kind of DBT in a nutshell. It's just because we all have to accept things we don't like. We didn't like being locked down in the pandemic. Many of them, and I can't change that. And I can white knuckle it all I want, but all I'm going to do is make it worse. So knowing what I have to accept and knowing what I can change, really important lessons. So that's the other half of that. Now we move to the change side of the skills. And there's interpersonal effectiveness, which is, if you pull it apart, it's how to ask for what I want and how to say no effectively. Now, that's such a needed adolescent and adult tool and child tool. How do I ask for what I want? How do I say no in a way that gets my objective met most of the time, that maintains the relationship with who I'm asking from or saying no to, and maintains my self-respect? So I love that. It's kind of the guts out of assertiveness. So it's just lovely lessons. And then the other part of that is knowing when to ask and when to say no. So it's got options for, does this person have what I want? Does this person have the authority to give it to me? Is the timing good? Is this a good time to ask? So there's a whole list of those. So I think the adolescents and the parents really appreciate that. That's all in the adult manual as well. So a lesson is a good place to start. So the fourth module is called emotion regulation. And the first part of the regulation module is understanding the model of emotions and how it works. So in the Linehan DBT model, the concept is other therapies use the word trigger. We don't, because trigger is like it happened and I had no choice. What we're saying is there's a prompting event in the universe that then set off some thinking, some actions, some body sensations, and then a problem behavior shot out of the hose. In the DBT individual and vulnerabilities, if I didn't sleep, if I didn't eat, if I was tired, think about a mom who'd been up all night worrying about a teenager, and then they snap the next morning. When we're more vulnerable, we're more emotionally reactive, right? Kind of the way it is. And so keeping those vulnerabilities down so that when a prompt event comes along, and keeping the vulnerabilities down is kind of like sleeping, which a lot of our adolescents have a problem with, eating healthily, staying away from mood altering drugs, taking meds as prescribed that are yours, and keeping up with your physical health. So there's a component around just let's keep our vulnerabilities low to prevent emotion mind reactions. So that's the in the emotion regulation. So you look at the model of emotion and says, okay, there's a prompting event. Prior to that, there's vulnerabilities. After that, there's responses. There's a brain response. If a grizzly bear walks in my office right now, I am not going to go, gosh, what emotion should I have right now? My brain has pre-wired that. So I'm going to respond with fear. And so it's like, what am I going to do with that fear? If I freeze, I'm probably lunch. So it's like, how can I keep my wit about me enough without going so high in that subjective units of distress that I can't make a good decision, can't be effective. So we learn about the model of emotions. We learn how to, take the side roads. Okay, if your prompting event upsets you, what skill can we use? And there's skills at all of these points. What are the outcomes? What outcome do you want from this? There's also a model of DBT for families and couples, where we look at what is it I want in my nest. That's Alan Frazzetti's work. He's kind of specialized. There's a book called High Conflict Couple that talks about how to validate each other and how to understand. So it's all the principles of DBT that have been now nicely adapted in many ways. So there's emotion regulation. And then the second section of that is what's called, we've got check the facts. So I go right back to mindfulness, say, okay, the person took my coffee cup. Let me check the facts. They have my coffee cup. That's all I got. Now I want to look at, is the anger that went up to a 5, a tsunami level, because they shouldn't have taken my coffee cup, is that emotion justified? It's understandable because I want my coffee cup. But is it justified to react at a 4 out of 5 of anger? So we've got check the facts, and then we've got 2 ways we can go. We can either problem solve, which means the emotion was justified and it fit the size and the facts. And so I'm going to problem solve with it. Or it didn't fit the facts, and I'm going to bring it down to the level where I can actually, then problem solve. And then there's the ABC skills. It's accumulate positive emotions, do pleasant activities. Research tells us that people who are doing things they like are less depressed than people who are not doing things they like. Shocking. But so looking around in a hard time for what is pleasant right now for me. I can always pet my cat. I can always call a friend. So even though times are hard right now, if they are, I'm looking to add more pleasant events. And then we're looking at cumulative positives toward our long-term values and goals. So that's that module. So there's the 4 modules.
Right.
Am I making sense? Am I giving you more
You're
detail?
absolutely making sense. And I can see, how parents listening to this can be hearing what you're saying and connecting it to, identifying the prompt, looking at the behavior that typically follows and building on those skills, which when you do that, you have to understand the process. And you've described the process of, responding to the prompt and then ensuring that you're having the appropriate response. But in the moment, oftentimes parents aren't thinking that way. And definitely the children and adolescents aren't thinking that way. So you're breaking down what seems like this big impulsive act into parts, breaking it apart. And then you're giving children, adolescents, and their parents the skills to bring things down, to bring the emotions down, but then also have the skills and tools to be able to act appropriately and to change the behavior so it doesn't damage relationships and negatively impact their daily lives.
So many parents make errors when they're so afraid, and I did too. When we're in emotion mind, when we're fearful, we want to clamp down harder. We want to protect. And so it's like being able to stand back and say, what is the function of this child's behavior? So those are the skills in individual therapy, whether it's adolescents or whether it's adult. We've got that diary card. My highest target is biting. My therapist looks at my card and says, and we do it virtually now on Zoom when we're on Zoom, but looks at my card, review. If the biting behavior showed up, I had urges to bite of a 5 and I bit somebody, then we're going to do what's called a behavior chain analysis that looks at the vulnerabilities of that event, just that event, not always. The vulnerabilities, the prompting events, the thoughts, the emotions, the body sensations, the actions, the urges. Then we look at the biting behavior, and then we look at positive and negative reinforcers. What is reinforcing that behavior? So a lot of times parents inadvertently reinforce behaviors because when they get scared enough, if adolescents are threatening, really difficult things, then sometimes they'll say, okay, just do this. And so what happens is reinforced inadvertently, but it's out of, do you know what I mean?
Yes, I absolutely do. And when you're saying that, I'm thinking about parents who are fearful of their child's response. I'm thinking about teens where parents say, I'm afraid to tell them to get off of their screens or to stop playing their video games because they're fearful of the response that they get, the anger, the rage. And it's interesting that you talked about the fear because there is fear for, your child's well-being, but then also your child's ability to cope in the world when they can't get what they want, when they want it. And it seems that this approach, which, addresses emotional regulation issues, anger, defiance, communication problems, anxiety, also has implications for adulthood. So you're really giving adolescents the skills that they need, not only to do better now, but to be able to handle things as they transition to adulthood.
Yeah. And we all have to accept things we don't want. And we all have to wait. Don't want to. And we all have to recognize that they're just things that can't be changed. So I have to figure out how to radically accept that.
Right. It's, again, like you said, changing the things you can and then accepting some things that you absolutely have to accept because they are there. They're part of your life. They're part of the situation right now. Like you use the pandemic as an example. We can't change that we are in this situation right now, but how can we cope? How can we find joy, things that we enjoy to continue to do? And how do we develop the skills and tools to handle difficult situations and come out on the other side?
In other theories, they talk about grit. They talk about resilience. They talk about the ability to make mistakes and to get up and to keep going. And that piece, that's the acceptance piece. That's learning that I can't change everything and I'm going to make mistakes. And so what can I learn from those mistakes rather than just go into shame and blame and, all that kind of stuff and giving up. It's like, how do I stand back up after I've fallen? And a lot of these emotion regulation skills are about a lot of that, about building resilience.
Right. And then when parents are involved in that process and that understanding and the skill building, they model the appropriate behaviors for their children because they are more aware of those chain reactions and those prompts and their responses and can model that behavior for their children as they grow.
Right. And we ask the parents to practice the skills just as much as the kid. It's not like go do your skills. It's like, I'm going to practice my skills to regulate my emotion. In the adolescent program, and we also offer coaching to the parents. So if we've got 2 leaders teaching the adolescent multifamily group, then one of those leaders will be available to the parents for coaching if they need be. And coaching calls are not an extra therapy session. It's like, okay, what's going on? What do you need? Let's look what skills you can use. Okay, let's take a breath now. And they're like 8-minute calls. But the parents have access to one of the skills leaders to gain coaching when they need it. Not as crisis intervention, but let's reach out. Let's talk about what can you use right now that's going to help.
And so when parents, families are kind of finished with the program, what can they expect to see? I know adolescents go in with different behavioral issues. It sounds like the relationship between the parent and the child, the parent and the adolescent is stronger as a result of going through this program.
That's certainly one of our hopes. If I can learn to, validation is not the same as praise. Praise is, you did a good job. And we use a lot of label praise. On the other end of that is, kid comes in hollering, screaming, upset because their friend didn't pick them up on time. And they're really upset. They're really disappointed. So to validate means I'm just simply listening to you. I can hear you. So many of us as caregivers or therapists or teachers or parents are busy trying to solve it. And it's like waiting to make sure we understand that they know they're heard before we ever try and fix anything. So it would be, you are so disappointed. They're screaming and hollering, having a temper tantrum. It's like, you are so upset that your friend didn't pick you up. You're so disappointed. And as we validate, emotions come down. They just come down naturally. There's decent research to support that. So once that's down, now we can problem solve. But many of us jump ahead. And therapists and teachers and parents are really equally guilty of that, I think.
We are. And I think, again, it's that response, that automatic response. And then we can't access the rational brain. The child can't, the adolescent can't, and the parent often can't until those emotions come down.
So the validating piece, when I'm teaching it, I want you to learn to listen silently on the inside and silently on the outside. Most of us do a pretty good job listening silently on the outside, but in the inside, we're cooking up our next rebuttal or our next thing. It's like, listen silently. And you can't come up with anything until then. The second step is to get into their shoes, look out through their eyes, and try and experience the world as they're experiencing it in this moment. Not to agree with them. It has nothing to do with agreeing or to condone. And the third part is to say it back to the other person in a way that they know you really heard them. And I always tell people, you're waiting for the proverbial head nod. You're going to get a physical head nod or a verbal head nod. Now you know. Now we can come over here and see if we can solve something.
Patty, this has been a really great conversation. And I think it's a great introduction to DBT and how it can be helpful to children, to adolescents, and to families. What is the best way for people to reach you to learn more about DBT services and get information even about your workshops?
Well, I teach a lot of DBT trainings to therapists and DBT therapists. If they're interested in getting involved with them and their adolescent in the DBT program, they simply need to contact the office. They can reach us at our website at choices.care. It's CHOICES.CARE. And, there's the phone number, the access. You can reach us through that. And what we like to do is have people say, I'd like to sign up for a meet and greet, which means there's no obligation on their part, no obligation on our part. And we'll have a 45, 50-minute just initial meeting just to decide, is this going to be a fit? Is this going to work? Is the child willing to make the changes that need to be made? Is the child willing to do this much work, an adolescent? Or the parents, either one. And it is a lot of work. It's an intensive program. It's twice a week. And it's one skills group a week and one individual session a week, and then family sessions certainly as needed. But all they need to do is reach out and ask for a meet and greet, and, we'll do one session. And then if there's a decision made with the youngster and the parents to proceed, then we will start with an initial assessment. So the only commitment then is like 4 weeks. Let's get in and let's figure out what the life worth living goals are, what's getting in the way, what are y'all willing to commit to? And then we do a contract for the next 6 months once we start skills group. And a lot of times that gets repeated for another 6 months, the second set. But that's what DBT is all about.
Wonderful. And I will definitely put a link to your website in the show notes. And thank you again, Patty, for being here. Like I said, there are a lot of kids, a lot of families in a great deal of distress at their wits' end. And it's great to know that there's hope and there are treatment approaches that have been validated and can be helpful to so many families. So thank you again for being here.
Oh, I hope it was helpful. And thank you for the opportunity to share.
Thank you again for listening. And if you would like more information about DBT, feel free to reach out to Patty directly. Her information is in the show notes. Please get on our email list so we can continue the conversation. And I want to hear from you about topics you would like us to discuss on the podcast, in future webinars, town halls, and for in-person events. Thanks again for listening, and I'll see you next time.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.